Good morning, everyone. Welcome. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon based out of New York City and Palm Beach, Florida. And this morning, I'm down in my Palm Beach office area. I am doing a live before I go to work, but I wanted to answer your questions um, and answer any questions that you have for me about hair loss or hair transplants um, because there's a lot of misinformation out there. And my goal is to help you understand how you can navigate addressing your hair loss effectively without um, without any misguidance. So if you're joining for the first time, welcome. We're going to jump right in. So the number one cause for hair loss, believe it or not, is genetics. And hair loss is polygenetic. It's either your mother's side or your father's side. It's both sides of the family tree. Now, we could do nothing about it, and we'll eventually potentially lose our hair. Some of us will lose more of our hair than others faster. But if you want to be proactive, as a woman, can I use spironolactone for hair fall? Absolutely. So spironolactone is one of the medications that I commonly prescribe both male and female patients. Women, I give a higher dosage, anywhere from 100 to 200 milligrams. Men only get 25 milligrams, much smaller dosage. And the way that spironolactone works is it prevents the binding of DHT to receptors. So what I was just about to say is that if you have a genetic propensity for hair loss, you're going to be more sensitive to this hormone known as DHT, dihydrotestosterone, which is going to miniaturize hair over time. And so being on medications like dutasteride, finasteride, and even spironolactone are critically important because those help address hair loss effectively. If you're joining for the first time, welcome. Do not hesitate to ask questions. RootMD, which I am the co-founder of, is one of the fastest, if not the fastest, hair growth community in the world. We started this over the summer. This was about now 12 to 13 weeks ago, and we are over 15,000 members strong, 15,000 people from around the world. It's unbelievable. I'm on finasteride right now, about 3 months, but shedding won't stop since month one. Is that normal? Typically, when I put patients on hair loss medications, shedding lasts anywhere from 2 to 6 weeks. The other thing to think about is, did you have an underlying telogen effluvium to start? This is a temporary hair shedding condition. If that's the case, then we have to make sure that that is addressed. Also, are you on minoxidil? That's another very important medication because minoxidil will help thicken the hair follicle. But typically, I don't see shedding lasting for 12 weeks, but some patients are going to be different. Um, the thing that you have to understand is shedding is not necessarily a bad thing. Shedding means that the medication is actually working, it's doing its due diligence. And as long as you don't have any other side effects from these medications, you're good to go. Okay, so if you're joining for the first time, welcome. I am down. I practice in New York City and I also practice in Palm Beach, Florida. I have two offices, so I go back and forth. Today, I'm down in Florida. I'm here for the next 2.5 weeks. Absolutely. Thank you for asking your question, Bundle. I hope I said it correctly. I'm down here for the next 2.5 weeks, and I'm seeing patients in my Palm Beach office. But I woke up early this morning, figured I'd do a little live at the pool before the morning gets going. And so feel free to ask me any questions you want about hair transplants, hair loss. I treat both female and male hair loss. So I see a tremendous amount of different types of conditions as it pertains to hair loss. So do not hesitate to ask away. So at the top of my pyramid, dutasteride is the most important medication that I have at my disposal to help you address your hair loss. And dutasteride decreases this hormone, this major hormone that miniaturizes hair by 90%. We also have finasteride, which is actually the most commonly prescribed medication. Good morning, Giggles. Most commonly prescribed medication in the world. It's FDA approved, and it decreases DHT by 60%. I like dutasteride better. I like to microdose this medication with a lot of my male patients. My female patients, there's no issues taking dutasteride on a daily basis. And these drugs are still the most important medications out there. Giggles is one of our amazing community members, happens to be a patient as well. And I put him on a regimen that I typically put a lot of my patients on, and it's a regimen that is really at the top of the pyramid. Now, Dutasteride and finasteride are important medications, but also minoxidil. Minoxidil is very important. Now, what minoxidil does not do is minoxidil does not prevent hair loss. Minoxidil will thicken that hair follicle, okay? It's going to thicken your hair follicle. So there's a misconception that, hey, if I use Rogaine, which is topical minoxidil, this is going to prevent my hair loss. And that's not the case, okay? It's going to thicken your hair. Now, there's nothing wrong with using topical minoxidil. Thank you so much for the digital roses. There's nothing wrong with topical minoxidil, but oral minoxidil is just better. Why is it better? Well, it's better because you're impacting every single follicle on the scalp. If you have irritation on your scalp, will finasteride and minoxidil still work? If you're, the question is, why do you have the irritation? Is it because of seborrheic dermatitis? Do you have LPP? What is the cause of your irritation? Finasteride and minoxidil should not cause irritation, and especially if you're taking oral. So we have to address the underlying root cause beforehand. A great question just came in. I went to a trichologist because I thought my temples were receding, but I'm not receding. I have healthy follicles, but he said the only problem is that I have less baby hairs. Had bad hairstyles for 1.5 years. So if you have less baby hairs, now we have when you use the word baby hairs, these are vellus hairs. These are little tiny vellus hairs, and these vellus hairs miniaturize. These baby hairs miniaturize as we get older, as we're experiencing hair loss. And so the idea is that when you're on hair loss medications, this reverses a lot of those baby vellus hairs and also keeps all those natural hairs, those thick hairs that you have, nice and beautiful. So I'm always in the camp that being proactive, going on hair loss medications is not a bad idea. Think about it as a proactive mechanism to address hair loss. Hello, dark sister. Good to see you. My mom's losing her hair, and I got her Bosley. I got her Bosley? Is that a good? I'm not sure what you're asking me. What did you specifically get her, Jennifer? How old is your mother? Is your mother in menopause? I'm assuming she is. If you're in menopause, guess what? Your estrogen levels go for a nosedive. Estrogen is protective for hair loss. Think about a female who is breastfeeding or is currently pregnant. They have a tremendous amount of estrogen, and that protects your hair. So if you lose your estrogen, DHT is going to start flaring, and DHT is going to miniaturize hair over time. And so that's why it's critically important to put a lot of female patients on dutasteride and minoxidil, and that's the combination that I typically put patients on. Okay, what are the great questions can I answer? What should I do at 17 years old? I'm receding. First off, if you're experiencing hair loss, it's never too soon to start addressing your hair loss. Never too soon. And so it's never too soon. And so my recommendation is be proactive. Be proactive in terms of going on hair loss medications, because those are going to help reverse the hair loss. Okay, what other great questions? I feel like I'm starting to lose hair. My hairline is starting to arch. I'm only 24 years old. Chris, this is the time to think about being on finasteride, on dutasteride, or minoxidil, even topical dutasteride from a company called Zion. I like this combination. If you're joining for the first time, welcome. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon based out of New York City. And of course, you can see I'm in Florida today. These are palm trees in the back. So I'm also in my Palm Beach office. I go back and forth from these two offices, and I do virtual consultations with patients really across the country. And I do also have international patients in Abu Dhabi, the UK, Australia, and Canada. Where is everyone from, by the way? Let me know in the comments below. Anyone from Florida, anyone from Palm Beach, anyone from Boca, anyone from Miami, anyone from New York City, the Big Apple. Let me know. I would be curious where everyone's calling in from. I also hope everyone is excited for the holiday season if you're in the U.S. and we have Thanksgiving coming up this week. It's a great time to spend with family and loved ones, but I spend a lot of time thinking about hair loss. Okay, we got Houston, Texas. We got Albany. Where else is everyone coming from? I know we have someone from Vegas. Let me know in the comments. Anyone from New York? I'm about 1 hour south. Amazing. Okay, so let's get this party going. Doc, I'm scared that using DHT will affect my hormones. My body is a hella sensitive. You can start microdosing these drugs. Start 1 pill a week. That's what I do with my patients, and see if you have any side effects. I typically go up to three pills a week when I'm microdosing for patients, and I don't see any issues. And that's basically the critical thing for you to understand. If you microdose, issues really disappear. We have Los Angeles, we have Vegas, we have West Virginia, um, California. Amazing. Do you have many women patients? Many. I would say about 60% of my patients are female. Half of what I do is, and we also have India. Amazing. Half of what I do is I treat female hair loss. The other half is I treat male hair loss. I do 50% of the time I'm doing medical treatment, and 50% of the time I'm doing hair transplants. That's why I love what I do. I get to medically impact patients, and I'm involved in the cosmetic aspects of addressing hair loss. I have a very slightly low testosterone in blood work. Is it safe? Is what's safe? So the key thing is that it doesn't matter if you have low testosterone, high testosterone. Everyone's response to DHT is going to be different. Okay, some patients are going to be really sensitive to DHT, and other patients are not going to be. I have a full head of hair, as you can see. I'm having a bad hair day. Well, that's why I'm wearing my cap. I didn't wash my hair yet this morning, but I am less sensitive to DHT. But regardless of that, I'm very, very proactive at going on hair loss medications. And what I do is I take oral dutasteride 2 to 3 times a week. I take oral minoxidil on a daily basis. I use topical dutasteride from a company called Zion. And of course, you're going to think this is crazy, but I wash my hair every single day. And I've been doing this for a long time. I do want to introduce everyone to Root MD. Root MD is a shampoo that I developed along with my sister, who's a dermatologist. And this is a hair growth shampoo that uses natural DHT blockers in it. It has saw palmetto, rosemary oil, and pumpkin seed oil, all very important, all very effective at addressing hair loss. When you use this shampoo, by the way, you leave it on for 2 minutes, okay? So wait 2 minutes. This is not just a rinse and wash. Usually, typically, when we put shampoo in our hair, we just wash it off immediately. That's not the case. And by the way, if you want to use our hair serum, this is the Root and D hair serum. You apply this to your scalp about 30 to 60 minutes before a shower, and then you rinse it off, and you can use this a couple times a week. This also has natural DHT blockers in it. So that combination together, by the way, this smells beautiful, beautiful. This combination together is a very good combination to help you start addressing hair loss. But it's not just, I always talk about natural, and Root MD is very focused on developing the best natural solutions out there that exist. But I'm also very, very focused on the importance of hair loss medications, because you cannot ignore the importance of being on hair loss medications. So look, there's a lot of anxiety when it comes to losing your hair. I see it all the time. That's why I have so many patients from all different walks of life, all different backgrounds, all different ages. Our hair is very much part of our identity. And even if you're losing, your hair feels thinner, or you have some thinning in a certain area of your scalp, it's a big deal. Someone else might say, oh, you don't have hair loss. But you know what? You spend the most amount of time looking in the mirror. You know what your hair feels like. I wish I knew what I knew today. I wish I was knowledgeable like about hair loss 5 years ago, 10 years ago, because I would have been more proactive. I have a little recession on the side. I would have been able to retain that. Absolutely. Had I been more active. Hey, Doc, glad that I've joined here. Wanting to ask this. I have a very oily scalp. To use minoxidil, should I only rely on oral tablets, but I'm scared of body hair? Raheen, you're not going to you're not going to be able to you're not going to turn into a Wolverine, okay, by going on minoxidil. Okay, you're going to possibly get some peach fuzz if you're female, but I'm not that concerned. Okay, oral minoxidil is a good option. You could use Rogaine foam too, even if you have an oily scalp. And if you have an oily scalp, it just means that you possibly need to be washing your scalp a little more frequently. You also need possibly a 2% ketoconazole shampoo, because the oily scalp has a lot to do with the buildup of yeast, melasthesia. So that's something to think about. And by the way, if anyone needs a consultation with me, you can always book a virtual consultation with me just by going to Kopelman Hair. It's that simple. What do you think about beard injections? Ahmed, I do beard injections for patients who have a condition called alopecia areata. This is an autoimmune hair loss condition where our own body attacks our hair follicles. And so that's basically one thing that I do. Okay, what other great questions can I answer? I'm going to scroll up and see what other great questions came in. I ordered my 300 milligrams of pumpkin seed oil with saw palmetto capsules. Amazing, Mazrel. I keep me updated. Let me know how things go and progress. What's amazing about our community is we have a lot of patients that come back to the Root MD community who've been here since the beginning. Mazrel is one of those amazing patients. I believe she's from the UK, but she can correct me if I'm wrong. But yeah, we have an amazing community. Root MD is really focused on answering all of your questions about hair loss and hair transplants, and that's essentially what the story is. So yeah, what other great questions can I answer for all of you? The hair serum, the serum is helping with thinning. This hair serum does help with thinning and prevents further hair loss because it has natural DHT blockers in it. Okay, that's the critical thing for you to understand. Hey, I've been getting hair shedding and thinning for the past 1 year. My maximum hair is gone. I'm 18 years old. You got to be proactive and go on hair loss medications because that will help reverse a lot of hair loss. And if you're experiencing hair loss at that young age, this is the time to be proactive. And you can be on these medications for a very, very, very long time. Okay, what other great questions can I answer for all of you? More than happy to answer all of your questions as it pertains to hair loss or hair transplants. Really excited about the growth that we have in this community. We're really at the beginning stages. Good morning. Hope everyone has the best day before Thanksgiving. Absolutely. Thanksgiving is around the corner. It's very exciting. This is a time to spend with family and friends. Opinion on the TikTok famous hair roll. Dustin, I think it's a bit of a gimmick. It has some natural things in it. However, you got to use it 2 minutes in the morning, 2 minutes in the evening. This is 4 minutes, okay? And it doesn't have as many natural DHT blockers as we have in our hair serum and in our shampoo. I also think there are more effective ways to address hair loss. It's more of a gimmick than anything. They absolutely had some videos that went viral. But look, something is better than nothing, as they say. Okay, something is always better than nothing. So that's a really good question. Hi, doctor from Iran. Amazing. Good to see you. I think you're probably the first person who's ever joined us from Iran. How to remove minoxidil buildup flakes. Okay. Well, if you're using topical minoxidil and you're developing flakes, you might want to switch over to oral. Also, if you're developing a flaky scalp, you might have seborrheic dermatitis that's being flared by using a topical. So you might strongly want to consider moving to an oral. That's something to think about. What do I think about dermal rolling or dermal stamps? I'm not a huge fan, and the reason for that is because I'm very afraid that patients are going to cause scarring to the scalp. If you overuse these devices, it's not safe. The other thing for you to think about is the importance of washing these instruments so that you do not develop any or reintroduce any bacteria into the scalp. That's basically the story. My mom had PRP done due to causing hair loss. Well, the thing that I want to tell you is with PRP, it's very much the importance is being consistent with treatments. Okay, it's never a one time done treatment. It's very much like getting Botox injections. You have to get the PRP done. So at my office we have patients do month 1, 2, 3 in a row, and then every 2 to 3 months after that. And that's how you consistently maintain results. PRP is platelet-rich plasma where we take blood from you, we spin that blood down, we isolate the growth factors, and we inject that into the scalp. The critical thing for you to understand is there's a tremendous amount of variability with PRP. If I take your blood on a Monday versus a Friday, guess what? Different levels of growth factors. And that's just basically the story. By the way, if you want to see, this is my background right here. I'm sitting at the pool. And this is before I get my morning started. Today, I'm in Palm Beach at my Palm Beach office, and I'm going to be seeing patients all day today. I go back and forth from New York City and Palm Beach, and I do virtual consultations with patients across the country. So I love what I do. I'm very fortunate. It's very rewarding because I get to help a lot of patients across many different age groups. And I've seen and been able to help patients accomplish amazing results with their hair. Now, of course, a lot of the ultimate results are up to God in terms of what we can do. But I always use the best things at our disposal, the things that are supported by research, and that are most effective for addressing hair loss. Okay. What other great questions? What is everyone doing for Thanksgiving? Anyone? I'm assuming if you're going to be with family, say family in the comments below, because I will be with family. I'm excited to spend time with my grandmother, who's now 98 and a half. Can you imagine having a grandmother that's 98 and a half? Family, amazing. If you're going to be with family, follow Diamond's comments. Just type family in the comments below. I'd be very curious. I hope that you're not going to be alone. If not, you can come to my home. You're welcome to my home for Thanksgiving. Door is wide open. Um, Unfortunately, I got very bad side effects from oral minoxidil, even 0.5 milligrams. What can I do about this? You might not be a great candidate for minoxidil. That just might be the case. In that case, I would think strongly about being on DHT blockers like dutasteride or finasteride. Especially if you're using topical and you're developing some flakiness of your scalp, minoxidil is probably not a good option for you. What is the best time to get your testosterone done to get better DHT results? There's not a time to get your testosterone tested. What's critically important for you to understand is just being on a DHT blocker is going to help because DHT is a major contributor for hair loss, regardless of what your age or your background is. Does male pattern baldness stop or will continue to full baldness? Everyone's different. Everyone has a different level of being sensitive to DHT. I know that one of my grandfathers who died at the age of 89 had a full head of hair. So he had some thinning, but he didn't lose his hair completely. And that's probably where I genetically got my hair from because I do have very thick hair, whereas my father does not. Thanksgiving is not a thing. Well, we'll make it a thing. You can always come to my home for Thanksgiving, Azrael. What about thinning hair? What should I use to thicken it? Ryan, you want to think about using minoxidil because minoxidil is going to take that follicle and it's going to thicken that. How do we know that? We've done many studies looking at the caliber of the diameter of the hair follicle. It thickens when patients are on minoxidil long term. That's why I like these medications as a proactive mechanism to address your hair loss. Okay. Thank you, Lori, so much for following. By the way, Lori is my mother's name, so it's a beautiful name. I love that name. So yes, so what do I practice in New York. I practice in Palm Beach. I go back and forth 2 weeks here, 2 weeks there. I do hair transplants in both areas. I treat hair loss everywhere. Of course, Lori is a beautiful name. And so I love what I do. What do you do if you have cats? Heard minoxidil is extremely dangerous for cats. Oral minoxidil. Don't use topical minoxidil because you're right. If you do use topical minoxidil and the cat happens to lick your palm, your hair, because you didn't wash your hands or licks your hair or your pillow, yeah, it could be toxic. I think it's probably a little overkill. There's probably an example of some cat that passed away from licking minoxidil, but millions of people are using minoxidil, and there's millions of people that have cats. So as long as you keep the bottle out of the way of the cat, you're good. However, if you want to be more proactive, then use oral minoxidil. Hey, doc, can you make detailed guidance on teenage hair fall for boys and girls? I treat hair loss as young as 5 years old. So we see patients of all ages and all backgrounds. I'm 42 years old, female, foam minoxidil gave me milligrams. I'm sensitive to medications, hard to treat. Jamie, we can put you on DHT blockers then. You can think about being on finasteride and dutasteride. These are natural. These are not natural. These are pharmaceutical DHT blockers. Or you can use things like rosemary oil, pumpkin seed oil, saw palmetto. These are also effective. So if you're thinking about using a shampoo, this is the Root MD shampoo. This has natural DHT blockers in it. Saw palmetto, rosemary oil, and pumpkin seed oil. You can use this as your daily shampoo. What about the efficacy of finasteride versus minoxidil? Two different approaches to addressing hair loss. This is the truth. Okay. Finasteride is a DHT blocker. DHT is what causes hair loss. Minoxidil is going to thicken the hair. So I typically put patients on both. Is it effective on people with alopecia? Absolutely. So no, I've never been to Doritos Farm, but I'll check it out in the future. Hey, recently I've been experiencing some small patches of hair loss behind my ear, both sides symmetrical. Are they circular patches, Gabriel? This might be alopecia areata. In that case, this is an autoimmune hair loss condition where our own body is attacking our hair follicles. What I would encourage you to do is thinking about, number one, going on hair loss medications, but you're going to probably need steroid injections, and they work. They work. Believe it or not, they work. I had a patient who had alopecia areata for 10 years, big circular area in the back of his scalp. We started giving him steroid injections every 6 weeks, and guess what? Boom, started to close. So these things are treatable. I talk only about hair loss. So that's basically the story there. Oh, you want me to create a YouTube video for patients who are younger in their teenage years? Absolutely, I will do that. That's a great idea. I will make a video for a younger audience to talk about hair loss. That's a great idea, because I think what happens is we don't get educated about hair loss until it's too late. It's better to know about hair loss beforehand. I always thought, you look at Rogaine, oh, that's for old men. I wish I'd known differently, because I would have started using it when I was younger. There was a misconception that hair loss is a bad thing. Well, hair loss impacts everyone, and there's no way around it. We can't avoid it, no matter what we try to do. So that's essentially what the story is. Now, I see a lot of different hair loss conditions. I see androgenetic alopecia. I see alopecia areata. What about hair loss that seems like female patternal hair loss, but DHT levels are normal on the blood work? So, Leah, females are a lot more complicated, okay? So, female hair loss can come from a variety of things. Genetics. DHT, you can still be sensitive to DHT even though your DHT levels are normal, especially if you have a genetic history of hair loss. Additionally, we have to look if you have a thyroid condition, because that can absolutely contribute to hair loss. Are you anemic? Do you have low iron levels? Another contributor. Low B12, low vitamin D, another contributor. Do you have PCOS, polycystic ovarian syndrome, that can flare your androgens? Another issue. So there's a lot of things to think about, Leah, when it comes to addressing hair loss. It's not one particular thing. Blood injections to the scalp, I think you're referring to PRP. This is platelet-rich plasma, and this can be a very effective way to address hair loss, but just recognize there's a lot of variability. One side first came in. I used Rogaine for work, but I don't know, this new side effect, it's not working as best. Gabriel, we should think about putting you on other hair loss medications, and of course, if you have alopecia areata, that needs to be addressed. Dutasteride for about 1 month, finasteride more than 5 years, which didn't work. Currently, my entire scalp my scalp from dutasteride seems to be getting thin. Is that bad? No, it could mean that the medication's working. But by the way, if you've been on DHT blockers for a long time, maybe it's possible you need to get a genetic test to swab in the mouth to see if you're sensitive to these medications. Sometimes patients are not. It's uncommon for that to be the case, but there are cases where I do genetically test patients to make sure that they're good responders to DHT. DHT blockers specifically. And Mazra, I hope you have a wonderful week. Too bad you don't have Thanksgiving there in the UK. Low iron, Danny, absolutely contributes, and that's why I send a lot of patients for blood work. Okay, very important to do blood work. If you're joining for the first time, welcome. My name is Dr. Ross Kopelman. If you could not tell from the scrubs, I'm a hair transplant surgeon based out of New York City, the Big Apple, one of the best cities in the world, and of course, Palm Beach, Florida. Okay, I got palm trees behind me, and I get to go back and forth. I spend 2 weeks up north, 2 weeks down south, and I do virtual consultations with literally patients across the country, and I have international patients as well in Dubai, Australia, really everywhere around the world. So I love what I do. I love it. I truly love what I do. This shampoo, the Root MD shampoo, is a great shampoo if you're experiencing hair loss. It's a combination of therapies when it comes to addressing your hair loss. I'm never going to tell you a shampoo alone addresses your hair loss, but if you're experiencing hair loss, using a shampoo that has the right ingredients, DHT blockers, is never a bad idea. Never a bad idea. It's a combination of things. So my regimen is at the top, oral medications. I like dutasteride or finasteride, and then I like minoxidil because it helps thickens the hair. And then you want to think about using possibly a topical dutasteride from Zion, washing your hair more frequently. Using the Root MD shampoo is a great shampoo to add into your routine. I promise you, you're going to love this. So yes, that's this is my favorite shampoo. We've looked at other shampoos. We developed this based upon looking at everything that was out there, and we put together what I believe is the best shampoo out there. Minoxidil is a good start, but I like DHT blockers because the root cause of hair loss is DHT, and minoxidil does not prevent DHT buildup. So that's basically the story. Dandruff, how to get rid of for real. Andreas. Sometimes you have to be on a clobetasol foam. You need a steroid to kind of decrease that dandruff. Occasionally, I'll put patients on 2% ketoconazole shampoo. And there's a drug called Zeruv that can be very effective. I did 4 washes with shampoo back to back. My scalp is very oily. Okay, we might need to add a prescription shampoo into your regimen, if you have a very oily scalp, because it's not caused. It's an underlying cause from the malassezia, and in that case, you do need to use a prescription shampoo to lower that. So, what are the great questions? Yes, that shampoo is good for people who have telogen effluvium. Telogen effluvium is a temporary hair shedding condition where if you do nothing, it's going to resolve on its own. But if you're proactive, even better. Does hair grow slower at the crown? Not necessarily. Not necessarily. You just might have more hair loss in that particular area. And the other thing to think about is if you're black, we always have to rule out conditions like CCCA, LPP. There's different hair loss conditions that need to be considered strongly when it comes to hair loss for black women and men. Is there a common connection to DHT blockers and breast cancer? Very good question. So specifically with dutasteride, if you have a breast cancer history, we want to be a little more cautious. That's why I put patients who have a breast cancer history on finasteride. Less issues, and you need to have a specific BRCA gene. However, it's never been clinically proven. There's no case reports, but it's something that we do talk about. Okay, what are the great questions can I answer? But overwashing can cause oily scalp. No. I do think probably putting you on a 2% ketoconazole shampoo, is going to be a good idea at least once a week to help decrease the oiliness of your scalp. Okay, what are the great questions? Thank you, everyone who's joined. I just want to let you know RootMD is an unbelievable community that was started about 14 weeks ago now. And it was started by myself and a patient of mine and my sister, Dr. Hannah Kopelman. And we all go live. We spend about 24 hours a week going live, educating patients. We've spent a tremendous amount of time educating patients about hair loss and hair transplants. And it's been very rewarding because we've answered thousands of questions. How much time should you wash your hair? Well, go like this. You wash your hair. If you're going to use the RootMD shampoo, you want to leave this on for 2 minutes. If you're using a regular shampoo, 45 seconds. And then always use a conditioner. You got to reintroduce moisture afterwards. So that's a really good question. Okay, what other great questions can I answer for all of you? Thank you, everyone who's joined. We are live talking about hair loss and hair transplants. Is CCCA an inflammatory condition? It is absolutely an inflammatory condition. And this condition starts in the crown area. So I know you're talking, Dark Sister, about the crown area, so I don't know if you possibly have CCCA. I'm not sure. I would have to see you as a patient to know. But yes, this condition requires steroid injections, sometimes doxycycline, which is an antibiotic, to decrease the inflammation. How do you microdose finasteride? Well, how do you microdose finasteride? You just take it less frequently. You take it a couple times a week instead of taking it on a daily basis. And I commonly do that for a lot of my patients, both men and women. Women don't really need a microdose. The reason I microdose for men is so that they don't get sexual side effects or other side effects that can commonly happen for male patients. Any additional benefits if I add fresh rosemary sticks into your shampoo? I don't want you to cause any additional irritation. Rosemary can be very, very irritating to the scalp at a certain concentration. If you want to add it, you can, but it's not recommended. But just be cautious because rosemary can be very irritating to the scalp if it's used at the wrong concentration. And rosemary oil, we know, is as effective as 2% minoxidil. We also know that it acts as a natural DHT blocker. So derma rollers work. Do you suggest it, doctor? Derma rollers do work in combination with minoxidil. However, I am a little cautious about telling patients to use derma rollers because I'm very afraid that they're going to cause a scarring alopecia. So we have to be very careful and cautious about how we trend in that direction. Okay, you guys have asked me amazing questions. I'm so thankful for all the new followers and connections in our community. We've had over 1,000 people join us this morning. I hope everyone's excited if you're in the United States for Thanksgiving. This is a time where we take off from work. Yes, mesotherapy is very effective. So I do PRP and mesotherapy in my office. I charge the exact same amount. I make more with PRP, but I tell 99% of my patients to do dutasteride mesotherapy because it is a lot more effective. Yes, that is a very good question. So, and yeah, there's a video I made about mesotherapy versus PRP that I would recommend checking out. Okay. Wish you the best of luck. I wish you all the best of luck. You all have been amazing. I'm so thankful for this community. So thankful. So, if you're joining for the first time, welcome. My name is Dr. Ross Kopelman. I'm a hair transplant surgeon based in New York City and, of course, Palm Beach, Florida. There's palm beaches. There's palms behind me. Palm trees behind me, I should say. Has anyone spent time in Florida? Let me know in the comments below. If you're from Florida, let me know below. If you're from New York, let me know below. Can I spam water every 30 minutes to get rid of acne? Well, we're not talking about acne today. We're talking about hair loss. So I'm more than happy to answer any of your questions as it pertains to hair loss. If you have questions about hair transplants, because I spend a tremendous amount of time doing hair transplants. I do FUE and FUT. FUE is where we take individual follicles out from the back of the scalp one at a time. Amazing. So Florida is a beautiful place to be, especially when it's cold up north. And then I do FUT, where we take a strip of hair from the back of the scalp. I do both types of hair transplants. What's exciting is the evolution of where hair transplants are going and where my practice is going is we are going to be a non-shave FUE clinic. That means we will never shave a patient ever again. You will come in with a full head of hair and you will leave with a full head of hair. We will no longer shave a patient and they're going to take 2 or 3 months to regrow their hair. That approach to doing hair transplants is going to be dead. And so I'm excited because I really do believe that we're pushing the field forward in terms of hair transplants. And yes, that does work. It's an advanced technique, and we're going to be doing FUE non-shave giga hair transplants, large hair transplants, where we're using anywhere from 3,000 to 5,000 grafts. I have markers in my breast, all negative. Is finasteride still an option? Yes, Jen, finasteride is still an option. And if you did want to go on finasteride, just sign up for a consultation with me and I'll get you started. We absolutely have to go through your entire medical history to make sure you're the appropriate candidate. What would you recommend for thicker brows and a goatee? Well, if you want to thicken your brows, I like Latisse. Latisse is a prescription medication. It's not covered by insurance, but it's not that expensive. It's this little brush that you use with a drop that you put, and you can use it on your eyelashes too to thicken your eyelashes. I also like minoxidil. You can use Rogaine, use a Q-tip, and go boom, boom once a day, and that can be very effective. Thank you. So this is what I love doing. I love educating about hair loss and hair transplants. And I'll tell you something. I am the most active hair transplant doctor in the world on live. I spend more time educating patients about hair loss and hair transplants than anyone else. I've spent over 100 hours live, okay, talking, answering questions in real time. I don't have time to look things up because I have to know it right on the spot. What was the first thing you recommended again? I'm not sure. It's called Latisse, Latisse, or minoxidil, which you can just use Rogaine and use a Q-tip and go boom, boom. But do not put Rogaine in your eyelashes. Only Latisse you can use there. And you need a prescription for that. Just had a hair transplant 5 months ago, taking dutasteride, using the shampoo, Revita, using Rogaine. What else should I be doing? Think about using the Root MD shampoo. This is a good option. Oral minoxidil is also something that you might want to consider putting into your regimen because it helps to thicken the hair follicle. How do I train myself to consume? Okay, well, I don't know. That's a good question. I don't know. I can't answer questions about drinking Everclear, but what I'll tell you is that what I can tell you, though, is that we're answering questions about hair loss. With a non-shave giga, won't the hair fall out anyway? Well, that's a good question. Yes, the hair we transplant will fall out, Dave, but the whole idea is that the hair where we take the hair from, you will not have to shave your head. And that for patients is a big deal. Okay, there's a lot of patients that are hesitant about going for hair transplant. They don't want to look funky. They want to recover faster. So yes, you're going to have some irritation and inflammation from the hair transplant in the front or wherever we transplant hair. But your recovery is going to be so much faster. Imagine like taking maybe 5 to 7 days off versus taking, waiting 3 months for your hair to regrow back to its normal length. And that's where the big innovation is. Why is Root MD different? Well, there's a few reasons. First off, we have an amazing community. That's number one. This is a support community like none other in the world. Number two, we looked at all other shampoos that were out there for hair growth, and this has the most natural DHT blockers in it. It has the right ingredients. It smells great, and the other thing is you have access to me. You have access to a real doctor, a hair transplant surgeon, a hair loss expert who can help you address your hair loss. So there's nothing like Root and D that exists. This is a very unique environment, and I believe Root and D will be synonymous with hair growth. It's going to be one of those mega brands, and you're part of that. And so this is a very special thing that we're building together. This community is more important than anything, honestly, and it's become a big part of what I do every day. Spironolactone or finasteride, which one is a good option? Finasteride is going to be better because it decreases DHT by 60%. Spironolactone is going to prevent the binding of DHT to receptors. So those are really good questions that you're asking me. What other great questions can I answer for all of you? Thank you so much for joining. I treat a lot of different types of hair loss. Androgenetic alopecia, which is genetic hair loss. Alopecia areata, which is an autoimmune hair loss condition where our own body attacks our hair follicles. Telogen effluvium, I see this all the time. This is temporary hair shedding that happens from whether you're taking a weight loss medication, whether you recently got sick, whether you recently broke up with a girlfriend or a boyfriend, stress to the body, any big surgery. Telogen effluvium, very, very common condition that I see. I treat PCOS hair loss. I treat menopause hair loss. I treat FFA, which is a autoimmune hair loss condition that can happen after menopause, sometimes due to different estrogen levels. Where am I located? I'm located in New York City and in Palm Beach, Florida. I go back and forth from these two locations, and I do virtual consultations with patients across the country. My consultations are $350, but they cover you for an entire year of care. That means you can see me as often as you want. You can have as many virtual consultations. You can come in person. There's no additional charge. Hair loss is comprehensive. It's an ongoing. It's truly ongoing, and so I plan on taking care of you for a very long time. And I have a lot of patients that have come from TikTok and from different social platforms and through the internet. And I love what I do. I absolutely love this. I love being able to address hair loss and hair transplants, and it's great. Yes, correct. Joanne, you know exactly. You're listening to me. You are becoming educated. You're becoming educated about hair loss, and I'm so happy that I'm able to be someone who can guide patients so that they know what to do. Is it okay to dye your hair with androgenetic alopecia? No issues. Dyeing your hair is not going to cause your hair loss. It can weaken the follicle over time if you're doing it all. If you're always dyeing your hair, but it's not going to be a big cause for causing you to have hair loss. What about a widow's peak? Some patients have widow's peaks and some patients don't have widow's peaks. It's very patient specific. Will this shampoo help with those issues you just mentioned? Yes, this will help address hair loss. This combination that we developed, our hair serum that has natural DHT blockers in it, saw palmetto, rosemary oil, and pumpkin seed oil, will work very beautifully with our shampoo. If you use this hair growth serum, you leave this on. By the way, it smells unbelievable. It smells beautiful. You leave this on for 60 minutes, and then you wash it off right after. Doctor, do you think Viviscal is a scam? I don't think Viviscal is a scam, but with Nutrafol and Viviscal, I always tell patients, don't use natural things to address your hair loss, okay? Until you get a blood test. You need to see if you have any deficiencies in B12, vitamin D, ferritin. We need to figure out what your deficiencies are before you run to go on treatments. Will prenatal vitamins help regrow hair? They can be helpful. But again, getting a blood test is always a good idea, Heather. If you're someone who's currently pregnant or breastfeeding, it's always a good idea to be on prenatal vitamins. You can't be on oral medications anyway. Red light therapy is also an option if you are in that stage of your life. PRP is also safe during breastfeeding and pregnancy. So there are natural things that you can absolutely use, Heather, and prenatal vitamins are on that list. But I always recommend to patients think about being on getting a blood test beforehand. And that's really the critical thing. If you're joining for the first time, welcome. I'm Dr. Ross Kopelman. I'm sorry if I'm repeating myself for those of you who have been watching consistently. I'm a hair transplant surgeon, hair loss expert based out of New York City and Palm Beach. I do virtual consultations with patients across the country, so do not hesitate to ask me any questions. Andrew asked me, are there any systemic meds people might be taking that would be a contraindication to the shampoo. No, shampoo can be used with any medications. This is a safe, all-around safe medications for all ages and all backgrounds and all different hairstyles. I'm from I'm from the real Long Beach, California. Amazing. Uh, does being a nurse attract more women? I'm not a nurse. I'm a doctor. Um, but it doesn't hurt to be a doctor. I think it helps. Is balding genetic, or can you start balding if no one is? Yes, you can have hair loss even if you don't have genetic hair loss. We all have some level of hair loss. That goes without saying. There's no way around that. And so if you do have genetic hair loss, you're going to be more likely to experience hair loss. But it doesn't mean it's the only reason for why you would be why you would have hair loss. What if I can't afford all those treatments? Can I use this shampoo? You can use the shampoo, absolutely. I would also consider using other things. Now, by the way, these hair loss medications are dirt cheap out of pocket. Minoxidil is like $10 for a 90-day supply. Dutasteride is like $23 or $32 for a 90-day supply. So yeah, and yeah, that's basically the story there. So if you're joining, do not hesitate. To ask me any questions that you want about hair loss or hair transplants. I'm more than happy to answer your questions. I'm excited because Thanksgiving is around the corner. This is day one before Thanksgiving, and so we try to go live all the time. We're on here, at least 24 hours a week answering your questions about hair loss and hair transplants, and we really love this. We love answering your questions. So that's why we do this. How long do I have to leave the shampoo on? 2 minutes, Mike, before you wash it off. 2 minutes before you wash it off. I've always wondered, do doctors and dentists have interesting conversations with each other? We always do. I have a lot of colleagues that are hair transplant surgeons and hair loss experts, and I love talking to my colleagues because it pushes the field forward. I started minoxidil on 10/8. How long will it take to see results? 4 months. You got to be patient, Haley. You're not going to see results overnight. No results happen overnight. Everything in life takes patience. Success in anything takes patience. It took me a long time to become a doctor. It took me an even longer time to become a hair surgeon. It takes you an even longer time to get great results. So when it comes to hair loss medications, what's critically important is no one is going to get results overnight. The funniest review that I got the other day, by the way, for Root MD, is someone said, I started using your shampoo. It's been 5 days and I don't see any hair growth. Of course, you're not going to see any hair growth. It takes 4 months. 4 months. 4 months. Patience is key. This is a great daily shampoo that I think you'll enjoy. If you saw results overnight, I'd be concerned about which project you're using. Exactly. So you got to laugh a little. Overall, we have amazing reviews from our patients. There's a lot of patients that join here live and even say, "Hey, I love the Root MD shampoo." So I don't pay anyone to say anything. I love taking care of patients. I love what I do. I'm very fortunate that I have an amazing. I call this a family. This is really the Root MD community is really a family to me, and I'm very appreciative to be part of it because it's a responsibility that I take seriously. Why I got finasteride for 3 months topical and still got ED issues, had to get off. Possibly, Omar, because you know what? Finasteride topical sometimes can cause more issues than oral because it gets into your bloodstream faster. You should think about using topical dutasteride from a company called Xyon, XYON, because the molecule is much larger. It's less likely to penetrate the scalp. Yeah. Coach Queena, thank you. Seeing Coach Queen is not even hasn't been like a patient that came to me officially, but she's part of this community and she's got tremendous amount of advice and guidance from just joining the live. And that's the beautiful thing. Do I have a condition? Do you use conditioner after the shampoo? Absolutely. You should use a conditioner. We are going to have a Root MD conditioner that comes out in 2026 at the beginning of the year. So look out for that. There's going to be a pre-order for that very soon. At the moment, though, if you use our shampoo, use any conditioner that has natural ingredients in it. But in the future, we will have a conditioner that's going to pair beautifully. What happens when you run out of donor hair for people with big heads? We're limited. We could use beard hair. We could use chest hair. But the best hair is in the back of the scalp. And that's really the truth. My doctor prescribed me dutasteride 0.5 milligrams, but I'm scared. Start 1 pill a week. And see if you have any issues. I don't anticipate you will. So that's essentially the story. Yes, you can use the shampoo with highlighted hair, Selena. This is safe for colored hair. No issues there. Do you guys help burn victims? We do. With hair loss, we do. Doctor, should dutasteride be taken after or with a meal because of lipophilic characteristics? What about finasteride? Doesn't matter. I tell my patients to take them at nighttime before you go to sleep. Actually, in the morning time when they wake up is typically when I like patients to take dutasteride or finasteride, but it really doesn't matter. What supplements are good to help for when you stop minoxidil so you don't revert back? So, Haley, you got to really think about hair loss medications as kind of a lifelong journey. You want to be on these medications as long as you don't have a side effect or a reason to stop, okay? Like a medical reason to stop. So supplements, yes, you can take things like Nutrafol and Viviscal, but I would always go for a blood test first to see what you're deficient in. You could always use natural things. So you can try our hair serum. This has natural DHT blockers in it. Smells great. It has saw palmetto, rosemary oil, pumpkin seed oil. It also has peppermint oil. It has jojoba and sunflower oil. It's very good for the scalp. So this is something you can use in conjunction actually with your minoxidil. I love doctors because they're the least biased people and never bite their tongue. Just bit my tongue. Look at that. What other great questions can I answer for all of you? This has been amazing. Thank you for asking me all these amazing questions. They're really good questions. So I'm very appreciative. If you have a Norwood 3 at 30, how long will it take for you to become a Norwood 4? Every patient's different. That's hard to say. Hair loss is progressive. It happens over time. Sometimes it accelerates for some patients versus other patients. And that's basically the story there. What other great questions can I answer for all of you? We've had over 1,500 people join this morning. Unbelievable. I'm literally sitting at the pool. I'm in my Palm Beach office. Well, not in my Palm Beach office. I will be. I have a patient at 12:30 today. And so I'm excited. A lot of patients who are coming to the office in a full week next week. I'm obviously taking off Thanksgiving, which is tomorrow. But I'm very appreciative for being part of this community and being able to take your questions and give you back answers that are going to help you address your hair loss. Now, I work in New York City and Palm Beach. I go back and forth. I have a very interesting life because I get to travel. I have patients from all around the world. It's a very rewarding field to be in. I will get effective on my thinning hair if I use rosemary oil diluted with pumpkin seed oil instead of minoxidil. Yeah. So this actually has the Root MD serum has rosemary oil, pumpkin seed oil, and saw palmetto and peppermint oil. It has a lot of good oils in it, jojoba, and as well as sunflower. Omegas are not bad for your hair, but at the top of my pyramid, when I'm thinking about hair loss, it's going to be dutasteride. Dutasteride is the most effective hair loss medication that we have because it decreases DHT by about 90%. And then, of course, we have finasteride that decreases DHT by about 60%. So that's at the top of my pyramid. Underneath that is minoxidil. Minoxidil is going to thicken that hair follicle. You can use Rogaine over the counter today if you want, but I like oral minoxidil because it impacts every single follicle on the scalp, and that's basically the story there. I do prescribe latanoprose, yes. So if you needed latanoprose for your eyebrows or your eyelashes, you can book a virtual consultation. You just go to the bio above, and there's a link to book. It's super easy to book a consultation with me. And I can even see patients tomorrow during the Thanksgiving day. So do not hesitate to book a consultation. But basically, the story is dutastaride's at the top, finasteride's underneath that. Then we have oral minoxidil. I like dutasteride and minoxidil together, or finasteride and minoxidil. I also like a topical from Zion. Topical dutasteride is a great option as well. And then the other thing that I also think about sometimes is spironolactone, because spironolactone prevents the binding of DHT to receptors. And then, of course, there's other things that you can do. You can do PRP, which is platelet-rich plasma. This is where we take blood from you, we spin that blood down, and we inject it into the scalp. It's very, very much like getting Botox injections. You have to be consistent with treatments. I also like mesotherapy, MESO therapy. Very common for me to do this. I like mesotherapy better than PRP because we're injecting pharmaceutical medications that we know work. There's no variability. There's consistency there. Latanoprose on the scalp is not really my go-to. That would be for the eyebrows and the eyelashes. Other things that I like. Okay, let's say you're breastfeeding, you're pregnant, or you don't want to use pharmaceutical medications. Then you can do red light therapy. Red light therapy is an option for patients, and you just have to be consistent. Just recognize a red light therapy helmet can be on the expensive end, but if you're consistent, it could be useful. What can I do for chemo hair loss? Well, Paula, if you're going through chemotherapy, this is usually temporary hair loss. My mother had breast cancer when I was 13 years old, but let me tell you, she has luscious, beautiful hair. She never went back on hair loss medications, and her hair grew back. But If you want to be proactive after you're done with chemotherapy, you can think about being on DHT blockers. However, I always like to consult with the oncologist to make sure that they feel safe, especially if you had a history of breast cancer. And then minoxidil. Minoxidil is a great way to help address hair loss faster. But yeah, there are natural things too. There's saw palmetto, there's rosemary oil, there's pumpkin seed oil. Saw palmetto decreases DHT by about 30%. Remember, finasteride does it by 60%, and dutasteride, which is at the tip of my pyramid, is going to be the most effective. It's 90%, and I put women and men on that. And yes, you could be premenopausal and postmenopausal and go on dutasteride. Men, all ages can go on this stuff. Which DHT blocker is the best choice for a woman who's in their 20s, unmarried? You can go on dutasteride. The only thing you have to understand in your 20s or 30s, if you're planning a pregnancy in the future, you stop just 3 months before a planned pregnancy. That's it. A lot of dermatologists do not feel comfortable prescribing these medications. It's because they don't understand it, okay? Or they're afraid of libido or erectile dysfunction for men. So you don't have to worry about that. I see a lot of patients, and I have a lot of female patients on these medications. Is twice a day the most you can take minoxidil daily? So oral minoxidil is once a day. Topical minoxidil, you only have to do it once a day. It has an 18-hour half-life, Haley, the topical. So it's not necessary to do it twice a day. And thank you so much for the person who just purchased the Root and D shampoo and the serum. Unbelievable. I'm so excited to have this sent out to you. This is going to be a huge part of your routine moving forward. We're so happy to have you part of the community. Root and D, you have to understand, Root and D is a lot bigger than this and this. Root and D is everyone who's here. It's me. You're part of something where if you needed access to a doctor, you know who the doctor is now. You have access to do a consultation with me if you needed me. What red light therapy for home use do you recommend? There are so many. Grow Well cap is a great option. If you want, I can send you a link. You can just message me. You can always follow me on TikTok or Instagram. I'm always here to help any patients that need help with their hair loss. Can I use products while on this chemo? So Paula, minoxidil you should have no issues with. I would be more hesitant with the DHT blocker unless we consult with your oncologist. And by the way, if you ever needed to set up a consultation, let's set it up so that we can go through your medical history in detail. Okay? What would results of once daily topical Rogaine be like after 8 months? Near full results? Thank you. 4 months to start to see improvement. Of course, you're going to get more and more improvement. At some point, you're going to plateau. But plateauing is not necessarily bad. That means the medication's working. If you go off the medications, you're going to resort backwards. So that's why consistency is very, very important to address hair loss. I'll be done in 5 minutes. Feel it, and ask the guy. Why don't you ask the guy while he's here? Just make sure he turns on the heat. Because I tried. I wanted to make sure. Okay, what other great questions can you ask? I'm sitting at the pool. My father's asking me whether the pool is warm enough, which is a very important thing, especially when you're in Florida and you have to go swimming. So we can't ignore the fact that we like to work hard and play hard, right? Life is about a balance. It's not just about talking about hair loss. Did you ask him? Oh, it's warm? Okay. It's about a balance, right? And so I hope that you recognize the importance of addressing your hair loss, because I'm here helping you no matter what, and recognizing that we have to also enjoy what's out there. We have to spend time with family, people that we love. We have to exercise. We have to stay healthy because we have one life to live, and this is a very important life to live. And thank you so much for the person who just purchased the Root MD shampoo. I'm so thankful for you for joining our community and everyone who's followed us and connected with us today. Unbelievable. My doc has me on minoxidil twice a day, 1 in the AM, 1 in the PM. It's too much, Haley, too much. Not necessary. It's not harmful, but it's overkill. It's overkill. And Haley, if you ever wanted to do a consultation with me, I'm here to help you. I have a lot of female patients that I help take care of. So really appreciative for everyone who's joined today. Thoughts on minoxidil for telogen and fluvian? It's a good option. Just recognize if you're having shedding, you're going to have accelerated shedding when you go on hair loss medications, but there's no way around that, and it's a good thing to be on hair loss medications. Okay, I want to thank everyone who's joined today. Thank you so much. I will be back here live again. This is not the last time. We go live every single day. Maris will be back here live as well. If you stop taking hair loss medications, you regress backwards. So think about medications or natural things for stimulated hair growth. Think about them as fertilizer for the hair. That's the critical thing for you to understand. Okay, I love this community. I love all of you, but I have to get going. I have to go exercise before I see my patients. Do not forget to exercise today. It's critically important for your health and your wellness. And I'm so thankful for all of you for being part of this community, for showing up, for joining RootMD. Please make sure to connect, follow. Do not hesitate to reach out to me afterwards. Scalp massages are decent, but they're not the big thing, Marvin, when it comes to addressing hair loss. And basically, the story is, if you need a consultation with me, I am in New York City. I'm in Palm Beach, Florida. I go back and forth, and I do virtual consultations for patients across the country. There's no double charge. We are a boutique concierge practice, and I love what I do. And saw palmetto is good. It decreases DHC by about 30%. It's in our RootMD products, our solutions for our shampoo and our hair serum. So yes, reach out to me if you have any other questions. Happy Thanksgiving to everyone. I will be on here absolutely tomorrow before the holiday season, talking to you about hair loss, and let patients know, let your friends know about RootMD. And by the way, if you're watching other videos on social about hair loss or hair transplants, tag RootMD so we can be part of the conversation. Very appreciative for everyone who's joined. This was an amazing live today. Close to 2,000 people joined. It's unbelievable. I'm sitting at the pool and we're talking about hair loss and hair transplants. And look at that. Come on, look at that day. I got to go enjoy it. I got to go exercise. Thank you, everyone who's been part of it. And do not hesitate to come back, because I love this, okay? And keep telling patients about the RootMD community. And if you need me, I'm here to help you no matter what, okay? Anyway, stay healthy. And don't forget, I'm here with you on your journey for your hair loss.